Diminishing senses. Because blindness and hearing loss can create anxiety in pets and affect the human-animal bond, which then affects their life quality, strategies to cope with blindness and hearing loss in pets should be considered. Loss of smell, touch and taste are rare as far as we know in pets. Vision loss. Cataracts and acquired vision loss all contribute to poor vision. People may notice this more at night or when walking outside where the dog is less familiar with its surroundings. Throwing a small object or setting up a little obstacle course may help these changes come to light. Blindness can occur gradually or suddenly. Treating the underlying cause is important, although for some conditions there is no treatment. How rapidly blindness occurs often dictates how well our pets adjust. Most dogs adapt and live normal, happy lives. Vision is not a dog's primary sense, and most adjust their hearing and sense of smell to accommodate. Helping a blind pet cope. Unsafe areas in the house need to be blocked off: pools, stairs, etc. You can place bells on other pets in the house. If you need to rearrange furniture, do it very gradually. Teach your pet verbal cues when approaching unsafe areas like stairs or corners. Cues like slow down, wait, watch out. They can still play with fetching toys and balls. Use ones that make noise or a Kong that you can stuff with smelly treats like peanut butter. Halos and visors, Optivisor, help prevent bumping their head into things. Living with Blind Dogs by Caroline Levine is a great resource. Hearing loss. Hearing loss starts with middle and high frequency sounds. People often interpret early hearing loss as behavioral, or they say their pets have selective hearing. They generally do not recognize hearing loss until it is advanced. It is usually only detected when there is loss on both sides and it is almost complete. Hearing loss in pets is usually very gradual. Communication with pets can become very frustrating, and they also will startle very easily. Helping a pet with hearing loss. Approach your pet within their field of vision to try and diminish startling them. If your pet is sleeping or resting, try putting their hand in front of their nose to allow your pet to smell you before you actually touch or startle them. Using a familiar scent may aid in awakening a deaf pet. If they still do not awaken, then softly touch a non-painful part of the body. Avoid the face. Train your pet to understand hand, arm and body signals. It would be wise to teach your dog in this manner prior to the onset of hearing loss. A flashlight can be used to get their attention and to guide them. Some pets can actually still sense vibrations, so stomping feet on the floor or clapping hands can also be used effectively. Deaf pets should be leash-walked only and supervised when they are in a fenced yard. They should wear a tag saying that they are deaf in case they get out. Arthritis in aging dogs. Approximately 25% of dogs are diagnosed with arthritis in their lifetime, and as many as 60% of dogs have radiographic evidence of it. Arthritis is due to years of wear and tear on the joints or due to a previous injury. Arthritis can affect any age, sex, and breed of dog. Lameness and difficulty rising are the most common signs. They may happen once in a while and get worse over time. Stiffness is common after periods of rest. Stiffness and lameness may decrease when the dog warms up a bit with some activity. Lameness often gets worse after periods of overexertion. Radiographs should be taken to rule out other painful conditions and to identify the location and severity so appropriate recommendations can be made for treatment. Most often a multimodal approach is taken that includes supplements, exercise, pain medication, weight loss where needed, and physical therapy exercises, which can often be done at home. Laser therapy and acupuncture are also options for older pets.